director of the Healthy Buildings Initiative, somebody who's taught me a lot over the years about how to think about indoor air quality. Dr. Allen, thank you.
Good afternoon. All right. Dr. John mentioned we spend 90% of our time indoors. I'm going to ask you to think about it another way. Take your age and multiply it by 0.9. That's how many years you've lived indoors, your indoor age. I'm 47. I've spent 42 years of my life indoors, in homes, apartments, schools, airplanes, trains, buses. Think of it this way, it becomes obvious and intuitive that the indoor environment has an outsized impact on our health. So much so that, as I mentioned at an event Ashish hosted a few years ago at Harvard, the person who manages your building has a greater impact on your health than your doctor. Think about that. Let me ask you another question. If you went and asked people what constitutes healthy living, what are the responses you'd get? They say, I need to exercise 30 minutes a day. I need to eat healthy. Smoking's bad. Outdoor air pollution is bad for you. That's great. How many people would IAQ come to their mind when asked that question? Not many. How many people would recognize that the majority of your exposure to outdoor air pollution can actually occur indoors? Today is part of the effort to change that. It is an immense honor and privilege to be invited to the White House to talk about indoor air quality. I want to thank President Biden, Vice President Harris, and Dr. John and his team for elevating this topic into the national discussion. The original sin in the COVID response was the failure to recognize airborne transmission as the dominant mode of transmission. In addition to decades of science showing better ventilation associated with reduced spread of respiratory viruses, the early clues during COVID were obvious. Nearly all spread indoors in underventilated spaces and super spreading events with 90% attack rates that could not possibly be explained by droplet transmission or everyone touching the same elevator button. The case for airborne transmission is airtight. This means that buildings should be the first line of defense. This wouldn't be a problem, except for the fact that we haven't designed and operated our buildings with health or respiratory infection control as the goal. Instead, we've had standards that target bare minimum ventilation rates, like the ASHRAE standard, ventilation for acceptable indoor air quality. Acceptable is not acceptable. These standards have led us to seal up our buildings, choke off the air supply, despite decades of science showing us that current ventilation rates are too low. So we have a novel respiratory virus that spreads nearly entirely indoors, smash up against our buildings that have low ventilation rates by design. Is it any wonder why this pandemic has been so devastating? And this devastation has been plagued by inequities in cases, hospitalizations and deaths by race, ethnicity, income, and work. It should come as no surprise to anyone that we see similar inequities when it comes to ventilation. Not only are the ventilation standards too low, but performance drops over time too. A school might be designed for 3 air changes per hour, but on average, schools get about half of that. And we see even lower ventilation rates in schools with majority Black or Hispanic populations, and lower ventilation rates in schools with majority of students on free or reduced lunch. Healthy buildings are at the nexus of COVID, health, equity, climate, and business. I'm going to make a series of recommendations. On COVID, to address COVID and other infectious diseases, it's imperative we think of buildings as central to our fight. I want to draw your attention to a report from the Lancet COVID-19 Commission, Task Force on Safe Work, Safe School, and Safe Travel. I'm joined by a few members today, Dr. Corsi, Dr. Marr, Dr. Miller, Dr. Michaels, Professor McCumber. We challenged ourselves this summer with a simple question. What set of actions, if every building took right now, would really move the needle quickly? We released a report called The First 4 Healthy Building Strategies that every building should pursue. Number 1, give your building a tune-up. We do this for our cars. We don't do it for our buildings. It improves indoor air quality and saves money. 2, maximize outdoor air ventilation. 3, upgrade filtration. We need to move away from filters designed to protect equipment to filters designed to protect people. MERV 13 is the new minimum. And we can supplement this with portable air cleaners. This is not the end-all list, but this is where you should start. There's a session later today on innovations that go beyond this. On ventilation metrics, we can't just say bring in more air. The obvious next question is how much? And here's where we have failed miserably for the past years and where we need to correct now. There is debate about the best metric, air changes per hour, CFM per person, CFM per square foot. And then there's debate about the specific targets. But where there's no debate is that the current targets are too low. They're not health-based, they ignore 40 years of scientific data, and they need to be changed. And while there's debate about these metrics and targets, as there should be, As I look across experts, irrespective of their preferred metric, I see it all converging on similar targets. In my opinion, there's strong scientific support for targeting 4 to 6 air changes per hour in rooms with typical ceiling heights. I also think there's strong scientific support for 30 CFM per person as a new target. I recommend that we immediately focus ventilation improvements in 2 key areas, those most at risk from COVID, seniors, and those most at risk of disruption from COVID, kids. This can be done right now before winter. If we make IAQ improvements, how will we know it's all working? I think we need to take the pulse of our buildings regularly. When you go to a doctor, what's the first thing she does? Takes your pulse, takes your blood pressure, basic indicators of human physiology and function. We need to do the same for our buildings. We can take the pulse of our buildings using lower cost indoor air quality sensors that measure things like CO2, a proxy for ventilation rate. Indoor air quality monitoring should become the norm in every building, much like we measure temperature. Seeing an IAQ monitor on the wall should become as normal as seeing a thermostat. Businesses beware. Individuals and institutions have developed new understanding and acceptance and expectation of health protections and tracking and reporting in their life. Portable health sensing technology is getting cheaper and more ubiquitous. This includes wearable devices, but also these portable real-time air quality sensors. That means as you enter a store, office, gym, you can immediately answer that question. Is the ventilation good in here? These expectations of screening, sensing, and sharing will not be reversed. The age of IAQ information asymmetry is coming to a close. On equity, we need to create standards for better IAQ and codify this, or else our approach to buildings will go down the same path of how we approach a lot in health. It'll be for the privileged few who can afford it. Standard-setting organizations like ASHRAE, CDC, NIOSH, others must develop health-based ventilation targets and IAQ standards for our buildings rather than these bare minimums. A future of healthy buildings that is confined to a select few would be a gross failing. We have a panel later today focusing on indoor air quality and equity. On climate, we must ensure that these healthy building strategies like enhanced ventilation and enhanced filtration are not at odds with our climate goals. Buildings consume 40% of global energy. In some cities, it's 70%. In response to the global energy crisis in the 70s, many tightened up their building envelopes to conserve energy, ushering in the sick building era. Energy efficiency at the expense of indoor health is a false choice. We can and must have both. We need to deploy existing and readily available technologies in our buildings to ensure healthy IAQ while reducing energy demand. Energy recovery ventilation, air source and ground source heat pumps, drawing electricity from renewable sources, and demand control ventilation, using air quality sensors to deliver air when and where it's needed. Thinking beyond IAQ, there's so much more to healthy buildings. My Harvard team released a report called The 9 Foundations of a Healthy Building. It starts with ventilation and IAQ, but talks about thermal health. And we need to think about lighting and acoustics, water quality, managing moisture, dust, and safety and security. In addition to the health and equity benefits, I want to point out that investing in healthy buildings is also just good business. We have an entire panel today focused on this point. Improving IAQ is a way to attract top talent, improve their health, and enhance productivity. Why spend dollars recruiting talent and then putting them in a place with poor IAQ where they can't think, concentrate, do their work, and they get sick more often? It doesn't make sense. Healthy buildings are really about protecting your people, your business, and your assets. Businesses must rethink their environmental health and safety and real estate strategies, moving past performative check-the-box IAQ and incorporate healthy buildings into their ESG plans. Put all this together, the COVID benefits, the health benefits, the equity benefits, the climate benefits, the business benefits. It becomes quite clear there's no reason not to improve indoor air quality in our buildings. Now that the world has experienced COVID, healthy buildings are no longer nice to have, they're the new minimum. It is not lost on me and the importance of this movement and today's event. Humanity has made great strides in public health over the past 100 years, as Ashish told us, by focusing on the basics of water quality, food safety, and sanitation. Where has indoor air been in all of this? And here's where I want to give enormous credit and thanks to President Biden and his administration, including Dr. Jha, for elevating indoor air quality at the White House. For the first time, clean air in buildings is front and center in the pandemic response plan, along with vaccines and boosters. Get boosted this fall. Healthy buildings represent one of the single greatest public health opportunities of our lifetime. The decisions we make today regarding our buildings will determine our collective health for generations. I'm overwhelmed with optimism by what this opportunity, this moment and movement represents for improving the health of all people in all buildings, everywhere, every day. Thank you.